actually what it means is that we can reach people virtually and online. We don't have to physically be in the same place. And boy, oh boy, is that going to be the subject of today's discussion. We have a fascinating company, a Polish company, which I think is making waves and has the potential to transform the way that medicine is done around the world, especially at the time of coronavirus. I'm going to invite our guest, CEO of StethoMe, Wojciech Radomski, into our chat straight away. He's kindly took out some time. Wojciech, hello.
Hello, nice to meet you.
Dude, how busy are you on a scale of 0 to 10?
I would say 12.
How busy are you normally on a scale of 0 to 10?
Normally, I would say 10.
Well, I mean, from every crisis, there are opportunities. There's things that can happen, and StethoMe is a great example of this. It's not like you've just invented what you do, but now more than ever, it's something which can change people's lives. Dude, I have one of these remarkable devices. Let's just tell our viewers what it is exactly that StethoMe is. You've got one, I've got one. Pretty much everyone have one of these.
Yes. So this is a digital smart home stethoscope. So our idea is to put this tiny device in every home. So whenever you or your kids will have any problems with their health, you just simply put the device on the chest. It records all the sounds and sends them to our AI, which provides you instant feedback about the condition of the lungs and heart in future. So based on that feedback, you can make the decision, you can send the detailed data to the doctor, you can have a televisit, and like the quality of the healthcare providers is increasing a much when we are talking about telemedicine.
So guys, think about this. This device is basically an electronic modern device of something that you see in a doctor's chest. Pretty much every doctor you go into, kids, the first thing they do is they listen to your chest and, breathe deeply and all the rest of it. It hasn't been updated in 200 years. Am I right, Wojciech?
Exactly. It's 202 years, I think, right now, from the time when the stethoscope was invented.
It's that kind of thing you never think about. Tell me, who came up with the idea? Who was the first person who thought, hey, hang on a second, this is a 200-year-old piece of kit, no AI, it's basically human having to listen. We could do something here.
So in fact, it's a very interesting story because for like 14 years ago, I created my first IT company with two of my other partners. And after 10 years of running that company, I said to myself, hey guys, we need to create something scalable, something that will help people. And I had in my mind the project from the university, which was IT in medicine. And I remembered a lot of different projects of my colleagues that were great projects in medicine. So I posted a note on Facebook saying, hey, we are an IT company looking for ideas within medicine. And this is how we met Honorata and Jędrzej, our current co-founders. They are PhD and professor in Adam Mickiewicz University from acoustics. And they came to us with this idea. We loved it from the very first day. We created a new company, we raised money, and this is where we are right now.
So just to give people an idea about how useful this is, you don't have to leave your home. And if your child is sick, the first thing you would do other than taking its temperature would be to do a quick check. And then in the app, you immediately get your first result, which is based on a huge amount of data that you already have, which is sent to a doctor. So how many recordings of lung results have you got that feed into your AI to give the initial test?
So in fact, we cannot talk about the recordings because we are analyzing every second of that recording. So we are talking about sound tags. And we've managed to gather over 1 million sound tags with over 38,000 detailed medical descriptions of them. So this is very important that the data itself is not enough for us. We need to get medical doctors' description, which are telling us what's inside of that data. And because statistics are saying that even up to 70% of family doctors are not able to properly identify respiratory sounds, we have to work with pneumonologists only, which have much higher skills. And besides that, for every recording, we ask at minimum 3 different doctors to provide the description. So we make sure that our algorithms are learning themselves from a good quality data.
So this is something that's extraordinary, which I maybe hadn't quite appreciated, which is that listening to the lungs is one of the few ways that you can really tell what's going on about the body for a long time. And these doctors, we were talking about this before the interview in the past, built up quite a lot of experience. But it's human error. You know, one day you're maybe not feeling so well yourself, the next day you're tired, the next day
Exactly.
you want to hurry home, so you're not quite listening. And then, as you were saying, more modern doctors trained in recent years, are less skilled at being able to hear what's going on in the human body. I almost dropped my StethoMe into the cup of tea I have underneath this table. That would have been quite an embarrassing moment live on television. So essentially, it's a sort of two-step process where the doctor gets an initial result and can still listen, him or herself, to the recording.
Exactly. So our long-term idea is very similar to the blood test. So how it's done with the blood? A nurse is taking a blood sample and it's sending it to the lab. In the lab, they are doing some tests and sending back to the doctor with the results. Our idea is very similar to this approach. So there's a patient at home that can gather the data. It can send the data to our AI, so to virtual lab, and the doctor can receive detailed results of that examination. So first of all, it gives an advantage to the user because on one hand, they are receiving instant feedback from the lab saying what's happening with their lungs. And then the doctor receives much more detailed information, which allows them to make much better diagnosis.
Now, we've had a comment. I've got some. We're cross-posting this on my channel. I've had a comment from someone saying this is invigilatia, so it's checking someone maybe about data, etc. So let's have a quick chat about data. The data that's sent from this device goes to my doctor and my doctor only, and is confidential, or it's shared somewhere else.
So in fact, our business model is based on the integration. So the data flow depends on our partner's approach. So we do not want to develop a separate solution. We want to connect it with existing telemedicine solution. So imagine that you have a telemedicine doctor, that company has a telemedicine platform, which has its own EHR system, etc. So such a partner connects or integrates with our solution, and they are sending to StethoMe only the sounds of the lungs without any medical data. So the medical data stays on the partner server and in their infrastructure, and they are, making everything to keep this data safe. And when it comes to StethoMe, we are just receiving anonymous recordings from the lungs and receiving the feedback to the user and to the doctor.
Okay, so we can be totally safe that this is nice and safe, and it's it's just one of those devices, Wojciech, where you look at it, you think, how come no one did this? 20 years ago, 15 years ago, even 10 years ago. Is there any competition out there for you guys?
Yes, for the it's true that 20 years ago nobody imagined having something like that, and nobody invented something like that. For the last 3 or 4 years, there are a couple of companies that are trying to do something similar. But what's unique when it comes to StethoMe is our AI approach, because the others are focusing only on the device. So the others are providing the devices to homes, but they are not providing this analysis. In our opinion, this AI is crucial, because I like to say that telemedicine without AI is like the internet without the Google search. So imagine the situation that each of us will have such a device, but the data has to go to the doctor to be analyzed. And we have the global problem of lack of medical doctors, so there will be no doctors to analyze such huge amounts of the data. So it's extremely important to develop those solutions that will filter the data which has some abnormalities and send them to the doctor from the data that everything is okay with the patients. So again, statistics are showing that even up to 80% of medical visits are unnecessary, and they are, generated by the people who has some doubts and they have to check it somehow.
which you think about especially now, how important it is. Visits to medical facilities around the world are basically paused or completely stopped. Patients can't get checked, and even in good times, a lot of patients don't need to be in that particular place. So the potential gain for health systems is extraordinary here.
Exactly.
We talked about you being busy from. Sorry, go ahead.
Yes, if I can add something to this, because I think it's very important. What current situation did is that the doctors are urged to move into telemedicine. So we have a lot of doctors that are, making the diagnosis just using the phone. So what we can see on the market, doctors are calling us and saying, "Hey guys, I'm not happy with that situation because I cannot listen to my patient's lungs, which is, extremely important. But still, I have to make the diagnosis, and this is risky also for my patient as well as for me because I'm not doing my job right." So this is also, another very important aspect that in these times when we are using from those telemedicine consultations, having additional devices, not only stethoscope, but additional devices that will provide us more data to the doctor is extremely important.
We'll talk about how you're rolling it out, but you said that you're normally operating at 10 on the 0 to 10 scale, which is running pretty hot, and now you're at 12. So how has the situation changed for StethoMe since the virus? Have you seen global orders expand? You mainly work with private service providers, so I know you've signed maybe a deal. I think just recently, in fact, with the Spanish provider, if I remember rightly.
Yes, that's exactly with the Spanish and the French one as well. So we noticed, much bigger interest in this time. A lot of partners are coming to us and want to have a quick integration. Additionally to that, we decided to help the doctors which are dealing the COVID-19 situation within the hospitals, because the problem that they had is that they were not able to use the traditional stethoscope while using those safety scaphanders and safety gloves and masks, etc. So they were looking for a completely wireless solution. So thanks to our technical team, within 1 week, they were able to develop additional functionalities that allow the doctors to use the stethoscope without any cables, and in real time, they can listen to the sounds. So this is additional advantage. And additionally to all that hype in telemedicine, so much more partners asking for our service, we are during the investment round. So connecting everything together makes me very, very busy.
Dude, well, kind of a good time. Glad it's before the investment round or before any decisions are made, because I'm sure the situation has changed quite dramatically. Are we seeing any interest from the US, China, really, really big country? I mean, French, Spain, huge markets for you. Do you want to go global very, very quickly? You focus on the European market? What does that look like?
So we are starting from European Union. This is our target market right now. We have to remember that we are talking about medical devices. Medical devices require very complicated certification procedures. Right now, we already have the CE medical certification for the whole European Union, both for the device as well as for the algorithm. And it's very important to underline here that we are the first and the only company in the world that managed to CE certify AI algorithms that are detecting abnormalities in the lungs. So because of this certification fact, we are focusing on Europe, but of course, our perspective is global, and we are already preparing, for example, for the US market by running clinical trials.
Oh man, exciting. So realistically speaking, when do you think you might be able to start selling in the US?
I would say 1 to 2 years.
Yeah, which I suppose is still pretty fast, all things considered. I want to talk a little bit about your journey, Wojciech. What have you learned about yourself since coronavirus started? Presumably you've been working from 10 to 12. What thing has surprised you about this period?
Well, it's hard to judge right now because things are still changing very quickly from week to week. What we definitely learned that working online, working remotely is possible. Before, everybody thought that we need to have those meetings with the office, and in fact, I can see that it's even working a bit better than previously. So people are more focusing on the tasks that they have to do. Meetings are quicker, meetings are a bit better. Everybody wants to finish it within a reasonable time. And I think we learned that even, all the tasks are going a bit quicker because we can focus on what we have to do. And this would be my initial observation, of the internal part of our company. From the external part, I think it's very important to notice that we were not prepared for such a situation, and we should be. Because we are talking about telemedicine for many years, and everybody was saying, well, this is a future, we'll think about it in the future. This is not something that we need to implement right now. This situation showed us that this was a mistake, because we had the possibilities, we had the companies like us, not only in the stethoscope field, but also in the other fields. We had the services, we had the law that was ready for that, but healthcare providers were not implementing those services. So I believe that if we would make step back and implement those telemedicine services on a higher level, today we will be living in a bit different community and a bit different system that will be much safer for all of us.
There's the old saying, Polak, mądry po szkodzie. So Pole is wise after being injured or hurt, and
exactly.
There's another phrase which is Polak Potrafi, or Polak Potrafi, I think I should say. How about StethoMe? You guys recruiting? Are you one of the very few companies that might be looking for talented programmers, people in AI, that kind of stuff?
So, we are right now finalizing this investment round. So before the investment round, we do not have any open recruitments, but I believe that we will close it very soon, and then we will for sure have new positions open.
Awesome. Now, you've been working, as you already mentioned, with the hospital in Poznan. Are you seeing wider interest from the Polish Health Ministry? Are they kind of, saying, how can we roll this out? What might look for Poland?
So we are pushing this solution to the Ministry of Health. We have some interest from the big insurance companies in Poland. In fact, quite advanced negotiations with them. So we really expect that very soon we will be able to launch StethoMe in Poland on a bit bigger scale. And we are also having requests from international hospitals. So, this is already only a few weeks that last after we managed to build that dedicated solution. So we should expect that in near future, we should see some gains of that.
Now, I wanted to surprise Wojciech by saying him that yesterday, as I was trialing this, I was able to measure my mother-in-law's lungs and my wife's and mine, but it was a little bit tricky to persuade my kids to do it. They didn't want to do it. But this morning, just before the interview, my daughter actually came in and said, I want to be your doctor. She tested me, and then she allowed me to test her lungs from various angles. And I thought this was going to be the surprisingly difficult thing about it, but in fact, it was surprisingly easy. And comparing that to taking my kids by the car to the hospital or to the doctor's surgery and then having to wait and going in, and then it's an unknown doctor that with a cold stethoscope that's trying to persuade your child to sit still and breathe deeply, which is actually a nightmare. The difference is remarkable. Now, let me just check, Wojciech. When it comes to coronavirus, obviously, if I'm asymptomatic, I don't think there's any way that StethoMe would help me. But are there lung symptoms associated with this virus? There's this whole thing about pneumonia, and it seems to be something where the lungs are really affected. So how does StethoMe would exactly help me if I suspected I had coronavirus? Could it be used actually for me to monitor every single day if I was sitting at home having traveled or for whatever reason?
Yes, of course. So one of the main symptoms of the coronavirus is connected with the lungs. You will have the problem with breathing. You will get probably pneumonia starting or things like that. So our system, our StethoMe AI, is able to detect all the different kind of abnormalities that may happen in the lungs. So in fact, it doesn't matter about what disease we are talking about. It means that we are able to detect any abnormality. So like coronavirus is very often connected with pneumonia. Pneumonia is connected with some rhonchitis. Our StethoMe can detect rhonchitis. So if you will have any early symptoms of having bronchitis in your lungs, StethoMe will be able to detect it. And after having such an alarm at the very early stage of the disease, you will be able to detect it and react with your doctor.
Okay, so this could be remarkably useful for anyone who wanted to sit at home but didn't want to come into contact with anyone else, which is, after all, what this whole lockdown is about. Wojciech, I have to say this is one of the most exciting pieces of kit I've ever had. I'm going to send this back to your team now because they told me that it's more than likely, after it's been cleaned, going to be used in a hospital to help patients somewhere in Poland or somewhere around the world, which is pretty cool, pretty exciting.
Exactly.
But I'm not going to lie. This would be quite useful alongside the thermometer that we have, an electric one. This would be super, super useful. So when can I buy one privately? Is that even an option? Is that possible?
We are working on that option. We started with partnering with big companies and launching this in Europe. They are speeding up with providing those services to final customers. Now they are within the stage of different kind of advanced pilots. But in the very near future, we are planning to do something to allow people like you to buy one and use its advantages.
So I think in this case, it's very much a question of watch this space. I think you guys are doing some fantastic work. So maybe we can talk in a couple of years' time when you've taken over the entire world and everyone's got a StethoMe at home. We can find out how it went. And hopefully we can look back at this whole horrible coronavirus period and say, well, that was difficult and terrible and challenging, but many great things have come from it.
Yeah, so in fact, this is our dream, to have StethoMe in every home like thermometers are today. Because today, thermometer is the only tool that allows you to monitor your health or your kids' health. And we are completely sure that it's very, very important by starting with lungs and monitoring with the lungs. Because in the lungs, most of the very important diseases are starting, and finding them at the very early stage is crucial for our health.
Yeah, amazing. I looked at it yesterday and I literally said to my parents in law and my wife, why haven't we got one of these? How is it possible? It's only just been invented. It's been 5 years of hard work. Well, Wojciech, thank you very much. And if this wasn't cool enough, guys, you just have to shake it to switch it on. I was looking around like, where's the on button? You just shake it like that. It's so amazing. I think it's a fantastic product. I'm obviously excited. I wish you guys the best of luck. I think the whole of Poland actually can, as we say, trzymać kciuki, hold our thumbs for your success, because this could well save lives in the very near future. So thank you very much, Wojciech. I will now say goodbye to you. Thank you. Thank you.
Bye-bye.
We shall keep in touch with Wojciech and his team at StethoMe. So thank you very much. I'm going to send this back now. And of course, I recommend to you the Fascinating Conversations in the Heart of Poland series. We have over 75 in-depth chats with business people, artists, authors, entrepreneurs, people with great creative ideas, musicians, poets, beekeepers, you name it. We've talked to people in Poland leading a fascinating life, because this country is going places, my friends. And boy, oh boy, do we need Poles around the world to solve some of the biggest problems, like, of course, Wojciech Radomski and his team. So thanks very much to StethoMe for sending me one of these. And of course, I invite you to share this episode with anyone you think might be inspired by the story of StethoMe and its potential to help us during the very difficult time of coronavirus. So we're ending this transmission. Thank you again, and I'll see you again for another episode of Heart of Poland.